Does shockwave therapy work for pain relief? Well, in this podcast, what we're going to do is we're going to demystify modern medicine and explore evidence-based treatments and help you take control of your health and well-being. I'm Dr. Michael Chillemi, and I'm going to give you my guide on this journey to your better health. In today's episode, we're going to dive into the fascinating and increasing popularity of treatments in pain management, sports medicine, and orthopedics. What am I talking about? Extracorporeal shockwave therapy, or better known as shockwave therapy. You may have seen clinics promoting it as a game changer for chronic pain, tendon issues, and joint problems. But here's the question. Does it really work? In this episode, we're going to explore all of it. We're going to tell you what shockwave therapy is and how it works, what the research says and about its effectiveness, and how does it compare to PRP and cortisone type treatments, and what could you expect if you decide to utilize this therapy. By the end of this episode, you'll have a much clearer understanding of whether shockwave therapy could be a game changer for your recovery. So let's jump right in. What exactly is shockwave therapy? So shockwave therapy is a non-invasive, FDA-cleared treatment for managing pain by promoting the healing of injured tissue. The process uses a high-energy sound wave delivered through a handheld device that is applied over the skin and over the injuries. The goal is to stimulate your body's natural repair process. This makes it especially effective for muscles, tendons, and ligaments, and sometimes even bones. Some of the most common conditions we can treat with shockwave therapy are plantar fasciitis, Achilles tendinopathy, rotator cuff injuries, tennis elbow, golfer's elbow, calcific tendonitis, osteoarthritis, ligament and meniscal problems in the knees, musculoskeletal problems in your back. What makes this so appealing is that it's non-surgical, involves minimal downtime, really no downtime, and does not require any injections. So this is why it is becoming incredibly popular with athletes and anyone who's looking to avoid those more invasive protocols and procedures. So let's now talk how shockwave therapy actually works. What is happening at the biological level? So the therapy is healing effects are supported by several key factors. First, we're going to increase blood flow. Shockwave therapy stimulates the growth of new blood vessels, a process called neovascularization. Improving circulation means more oxygen and nutrients to the area. Nutrients can reach the damaged tissue and speed up the repair. Cell activation. Specialized cell like fibroblasts, which repair connective tissue, and osteoblasts, which build and repair bones, are activated by the sound wave, breaking down scar tissue. Many chronic injuries are caused or worsened by scar tissue or calcification. Shockwave helps dissolve these, restoring flexibility and range of motion. Pain relief. Shockwave therapy can desensitize overactive nerve endings, reducing the pain signals sent to your brain. This is a big part of why so many patients report early pain relief, tissue regeneration, and reduced inflammation. Finally, it stimulates your body's release of natural growth factors and promoting the healing of tissue and reduce swelling, further facilitated to your recovery. The combination of all of it makes this therapy highly effective for both chronic and acute injuries. So you might say, hey, Dr. Chillemi, that sounds amazing. I don't know if I believe you. What does the research say? So the science says this. It's really, really solid. Solid evidence that shows shockwave therapy works. When you break it down, some of the biggest studies, these are what some of the biggest studies have said. When we talk about tendon injuries, a meta-analysis of 45 clinical trials reviewed its impact on conditions like rotator cuff injuries, Achilles tendinopathy, plantar fasciitis, golfer's elbow tendon, tennis elbow. And what it showed is the biggest benefits were seen with the rotator cuff injuries, where a patient reported substantial pain reduction and improved mobility. For the Achilles tendinopathy, shockwave therapy improved both pain and function significantly. Plantar fasciitis, which is notoriously stubborn, showed excellent pain relief. For tennis elbow and golfer's elbow, the improvements were moderate, but still very, very meaningful. Joint conditions like osteoarthritis. A study on patients with severe osteoarthritis compared physical therapy alone to physical therapy combined with shockwave. The results: patients receiving shockwave therapies, get ready, because I'm going to give you a number. Get ready for this number. Patients receiving shockwave therapy experience an 82% improvement in functional ability compared to the 48% with just physical therapy. So that's an additional almost 50%, almost, it's close. It's a 40% improvement from just physical therapy alone. So when you stack the shockwave therapy with physical therapy, you significantly improve those numbers. Musculoskeletal pain, myofascial pain syndrome. For patients dealing with neck or shoulder pain or back pain, a review of 27 clinical trials showed significant relief, often outperforming other therapies for pain and muscle recovery. So, back in the day, there used to be many commercials about, I'm not only a client, I'm not only an owner, I'm a client. So I've done shockwave therapy. And I can tell you from personal experience, my back is notoriously stiff and very non-flexible. I'm not the most flexible person out there. I've done 6 sessions with shockwave therapy, and my muscles and my ability to move, bend, lift in only 3 weeks is probably about 90% improved in my flexibility, 90% decreased in my pain, and yeah, even I have pain, right? I can't always treat myself, and doctors are usually the worst patients. So for me to sit there and do it, is me finding the time is always my problem. But I did this, and I really feel a significant difference. So I can attest, for musculoskeletal pain, it really, really works, and which is why I'm actually doing this video, is because I had patients ask me, does it really work? What's the science out there? I don't understand it. Give me some more information. So this is why this video came to be. So if you compare this to other treatments, how does it stack up? So if you talk about treatments like steroids, corticosteroids, or PRP injections. So corticosteroids are excellent for short-term pain relief, but the benefits fade over a few weeks. In contrast, shockwave therapy has shown longer lasting improvements for conditions. whether it's rotator cuff, plantar fasciitis, osteoarthritis, knee conditions, back conditions, it's shown a longer relief. When you compare shockwave to PRP, PRP involves injections, concentrated platelets, and growth factors to kickstart repairs. Studies show that PRP slightly outperforms shockwave therapy for pain reduction in some cases. However, shockwave therapy has the advantage of being non-invasive without the risk of infection or complication associated with injections. Ultimately, PRP or shockwave therapy could better improve your condition depending on your goals. So in our clinic, we have the luxury, I'll call it luxury, of utilizing both PRP and shockwave therapy, which with physical therapy, we added it all together and we've had some incredible results for patients. And it's been really, we've had our machine now for, I want to say, almost 2 months. And our patients have really experienced a significant improvement. Now we've started combining that with the PRP, and I'm starting to see even bigger improvements, this is why I wanted to talk about it, is because when you combine it together, so the shockwave patients were already receiving chiropractic and physical therapy, so that was boosting them up. Now we added that extra layer of PRP on top of that. The results are getting better and better, and the healing, the deep tissue healing that you get from the combination has been off the charts. And yes, I do have to do my own study. I should do my own study. We'll see if that comes to be. But it is really very, very promising for patients with pain, and they don't know where to go, and they don't want steroids, and they don't want some of those other therapies that are out there that they have not had great results with. This has shown great promise together. Sometimes you got to think outside the box as to what I can do and how do I get my body to regenerate. And when we started looking at, okay, we can do it with shockwave, we can do it with PRP and that combination, and then you add the physical therapy into it. So you're strengthening your core, you're strengthening your tissue, you're strengthening your ligaments. That is so, so amazing. The results have been so fantastic. And I'm very, very happy to report that here. Okay. Sorry, I digressed. Let me get that. Okay. So what could you expect during a shockwave treatment therapy? So if you ever wondered what it actually session looks like, it looks like this. First, we're going to pinpoint the treatment areas. We're going to apply some conductive gel, basically the gel that you would use like with an ultrasound. And we use a handheld machine that's going to deliver bursts of energy into the injured tissue. Sessions are very comfortable with maybe minor discomfort if the deep tissues are targeted. Each session lasts about 15 to 20 minutes. Most scheduled sessions are anywhere between 6 and 12, depending on your condition. And they're either once a week or twice a week. So usually I'll have patients that come either once a week for 6 weeks or twice a week for 6 weeks or 2 times a week for 3 weeks, depending on their results. Many people will experience improvement in the beginning, but it's often the cumulative effect of what's happening for your best results, right? So even though, Staples has that easy button, everybody wants the easy button in life, and they want, once they feel the first, oh, I'm feeling a little relief, I'm good, I'm done. No, you're not. So the tissue takes time to heal, and we have protocols and procedures set for a reason, because we know what it's going to take for your tissues to actually heal. Whether you start feeling better, which you will in 1, 2, or 3 sessions, but most times for you to get the effect you actually need, for it to be more long-term and not a short-term goal, Not a little bit. You don't want something that's going to last for 3 months and be done. You want something that's going to last for 6 months, 12 months, a year, 2 years. That's what we're talking about here. It's pretty exciting stuff. Last thing I'm going to talk about is, does insurance cover this? It's a mixed bag out there. There are some plans that can cover it, some plans that don't. You really got to check with your insurance company. But at the end of the day, life is short. Pain stinks. No one wants to stay in pain. If it's a few sessions, it's not the end of the world. And if you can get the relief you want, that at the end of the day, money spent on you is money well spent, right? You can go out and get dinners and this, that, or the other thing, a new TV, this, that, blah, blah, blah. But it's not going to fix you. So at the end of the day, if it costs a couple of shekels, couple of bucks to fix you, aren't you worth it? Isn't your health the most valuable thing you have in life? And if you don't know, if you say no, health is not, then you don't know because you've never had a problem yet. When you have a problem, then I promise you, you will say, Doc, my biggest, biggest thing in life, the most valuable thing I have is my health. Your health is your wealth. This is about as best as I can tell you. Your health is your wealth. Do not shortchange your life on what you do or don't do because you're not healthy. Right? So I'm going to give you a 30-second story. I had a patient yesterday, a 65-year-old woman who had very bad knees, and she just retired. Her golden years, it was the best years, right? She retired. That's it. She could do whatever she wants. Here's the problem. I said, I want to scan you on a second. We have a second floor in our facility. I want to scan you. You have to walk up these stairs. She says, Doc, I cannot walk up these stairs. I can't walk up 6 stairs, 8 stairs, 10 stairs. We have 12 stairs. She says, I cannot do it. I says, you just retired, your golden years. What are we doing? Your health is your wealth, right? You work all this time for life and then you can't do anything. I says, how are you going to take the trips that you told me you wanted to take when you retire? How are you going to play with your grandkids? How are you going to do all these things that you told me a couple of years ago that you want to do? Because she expressed, I want to do this, I want to do this, I'm getting ready to retire, I'm going to go here, I'm going to go here. Now, just a couple of years later, she can't even go up a few steps. I was very sad for her. Hopefully, I'll give you an update on her in a few weeks after we start her treatment protocol with a good positive result. But your health is your wealth. So whatever it is, it is. Fix you. The information I've given you is my opinion alone. Please don't take anything I say as medical advice. That is my opinion. If you have a problem, please speak to your healthcare provider about this condition. I hope this episode gave you some clarity about whether shockwave therapy might be an option for you or your loved ones. If you found this episode helpful, please subscribe. Share it with a friend. Share it with a family member. Share it with a cousin, uncle, brother. Anybody who you think could benefit, please share it. Because education is the first step into healing. I'm Dr. Michael Chillemi, and it has been my pleasure to talk about what's important, which is your health, because it matters. Till next time, be well, be safe, be healthy.